Welcome to Chatspot Live. I know we don't do this on your regular, but you know, if we go the extra day, then we're doing it for an amazing, beautiful, educative, entertaining, empowering reason. Karibuni sana, my name is Mikali Mary. We have an amazing show lined up for you.
Good afternoon, or is it evening? It's already in the evening, guys. Imagine it's 20 minutes past 4, and we are so glad that you got to join us today. Of course, today we are talking everything STIs, because I think that's a very viable topic. And Maramingi, we've had the misconceptions, which we are about to demystify over here, because we have professionals. But before that, let me just say my name is Nana Witty, and please do not talk about football today. We are not talking about football. The only PSV thing we know ni matatu, and karibuni sana, my name is Nana Witty.
It's very interesting because it has taken everything for Nana to just hold back. But like Nana said, today we're talking matters your health, we're talking matters STI, and the last time we had a live, we had Mary Stops in the building, and today we have them here as well. We have Eve and Gabriel in the studio. Karibuni sana.
Thank you.
Nyinyi mmekuja kutu educate. Lakini kabla to get into the topic and the conversations that we're having today, kindly introduce yourselves.
Thank you.
Ladies first.
Thank you, Mikali. Thank you for having us here today. My name is Evelyn Mukuhe. I am a registered nurse at Mary Stops. I am based at GQuat Premier Center in Nairobi CBD.
So, good evening.
Good evening.
My name is Gabriel Nduto. I'm a registered clinical officer. I work with Mary Stops Kenya. I coordinate social franchise services, that is the private sector engagement, and I'm based in Kisumu at the moment.
Yeah.
So 6 years in the practice of sexual reproductive health, and 7 years, right?
Yeah.
Did I get the numbers right? My God! So did you always know this is what you wanted to do for the like? How did you stumble into this space?
I would say I didn't know I would be in this space.
Okay.
Initially, I wanted to be a lawyer. And I got an admission to JQuat.
Wow.
Then somebody was sick somewhere. I walked into a facility, and I really felt that I needed to be here. And then now I went to school, studied, and now I'm changing lives.
Wow. That's beautiful.
Thank you.
Ruth, and you?
For myself, I wanted to do IT, so but I was taking care of people in my life at that time, and we were always in and out of hospital. And then it occurred to me that I would do better as a nurse, because I was already doing it, but without the training.
It was already like a blessing in disguise. The happiest place you've been now.
Yes.
Yeah, great. So let's just dive into just first off, since we're talking STIs first, because when I was taught, it was back in the, in the and I was told it's STDs. So what's the difference between the STDs and the STIs?
Let me take that one.
Okay.
So we use the terms interchangeably, but STD is the sexually transmitted diseases. STIs is sexually transmitted infection, which has not become a disease. Yes.
Okay. That is just before.
It's like HIV and AIDS.
Yes. HIV has not become AIDS, so the STI has not become a disease.
Okay.
Yes.
Okay. And we talk about STIs, when we can just break it down. Let's not assume that everybody knows what that is.
Yeah.
Gabriel?
Yeah, STI, as she'd said, they are sexually transmitted. Most you'll have them after engaging in sexual intercourse with the infected person, and there are various forms. They're the ones that are caused by viruses and others by bacteria. So it depends on what you will be presenting with when you walk to a facility. As healthcare professionals, we are able to differentiate and do a lab test and tell you exactly what you're having and treat you accordingly.
Okay. Yeah. So would you like to break it down, like this is caused by this, or maybe just name a few so that we understand some of the conditions or the infections that one can get?
Yeah.
So I'll just name the ones that we are common in, the ones that are commonly known.
Yeah.
That would be syphilis, then there is gonorrhea, then we have chlamydia, hepatitis B, HPV, and of course HIV.
Yeah.
Yes, so these are the most common, and these are the ones that most people you'll find are struggling with.
Yeah.
Yes.
But then when it comes to the microorganisms causing the infections, you say there's a viral, and then there's also this other one. So which ones are more serious than the others?
Okay, we can say that sometimes we have HPV, which is there are many types of viruses that are HPV, but there is 16 and 18, which causes cervical cancer. Then we have HIV, which everyone knows is a very serious infection that you have to live with for the rest of your life. And then we have something like herpes, which is an infection, a viral infection that you can live with without knowing, which is dominant in your body, but can come out, can react. That's when you know that you have herpes. Yes.
So it may not.
Yes, you may not know that you have the infection.
So there could be a carrier and I don't even know, but I'm causing the same.
You could be spreading it, but you don't have symptoms. You cannot say you are a carrier, but before the symptoms come, you won't know you have it, but you could be spreading it. Yes.
You wanted to say something,
Yeah,
Gabriel?
I wanted to add that regardless of the causative as in organism, all STDs and STIs are very, very dangerous. And it's good that we come early, be screened, and be treated, because at the end of it, there are what we call complications, which could things like infertility, and to the worst extent, even death.
Okay. Maybe we jump right into screening, because I mean, if I can be walking around not knowing, first of all, you're getting these diseases because you're having unprotected sex. Let's just start there. Haujapatana na lifeguard mahali. Okay, to me, I believe you. So this is happening because of that. But then for me to get out of my house and go to hospital to be checked or be screened, it's probably because I'm feeling some type of way. So what are some of those feelings of some type of way that maybe will lead? Should I just walk in there even if I know I've been leading an okay life, or I have a trusted partner? Where does it begin, the screening?
So we can say that when you have the symptoms, that's when you come for the screening. But don't wait for the symptoms to come for the screening, because when you are waiting, you could be having complications. But some of the symptoms that you can get for STIs is, for ladies, a smelly discharge. You could be having pain during sex, pain during urination. You could be having a rash, a sore in your genital area. So once you find something like that, just come to the clinic. But if you know you're not having protected sex, you know you're not being safe, it's good to come for checkup once in a while. Yes.
And when you talk about screening, there are different types of screening for the different kinds of infections. Ona sasa kizungu. But it's fine. So there are different types. The urine test is also like, are there specific infections where you are just needed to do the urine test, and others that you have to do the blood work?
The moment you walk into a facility, you having these symptoms, as my colleague has explained, you'll find a qualified healthcare practitioner who will listen to you. Then now, depending on this, it can do it syndromically by you having this discharge, you having that pain there, you having that there, then treat you. But that is mostly in low-income setups, whereby there are no laboratories available. But in good setups, your blood work should be taken. Blood will be drawn from your body, then taken to the lab to be analyzed. We can also use urine. We can as well use swabs in case of like the sores, those that have sores, can swab it and have it checked in a lab. We can as well, to some extent, even use lumbar puncture, take a fluid from your spinal cord and use it. But those are extreme cases. The most basic ones are urine, blood, and mostly swab test. To use.
When I listen to the signs that you mentioned, mostly they were towards the women, and I'd like to know for the men as well, like what do they look out for? We are assuming they're already living this career uku kwa dunia. So what are some of the signs? Because we've had things like, for men it doesn't show as much, vitu mingi. So maybe you could just clarify that for us and let us know what it is that men should look out for.
Okay, so there are some types of STIs that will present in women, will not present in men, will present in men, will not present in women. But they are basically the same types of symptoms. It is painful urination for the men, also discharge as well, genital ulcer as well for the men.
So take us through the steps. I'm the patient coming to Mary Stops. What's the first thing that you do to me, and what's the procedure like?
All right, so once you step into our clinics, of course you will come to the reception, then you'll be shown to the doctor's room, where now you will tell us exactly what is ailing you. You'll first tell me the symptoms, so I know what to test for. You'll tell me whether you have some of the symptoms that I've mentioned, and if you have any of them, then I'll know whether I need to, if it's an ulcer, I'll need to look at it. I'll need to see whether it's gonorrhea or it's herpes. Then it gives me direction to see which type of STI you have. After now we've found out what type of STI you have, then we can embark on treating you. In all STIs, mostly bacterial STIs, they are treatable. Yeah, with simple antibiotics, you're good to go.
So the viruses are the problem?
Yes. And then after that, we'll do counseling. So now you don't come back again with the same issue.
But I can imagine you've just treated me, but what about my partner? Like, what happens? Because we've heard about the reinfections where you have been treated as a woman, you've been treated, but then you go home, you didn't come with your husband or boyfriend or partner, or even, we know how Nairobi is. So what happens now, since you're the only one that has been treated and the rest have not?
So during counseling, we will ask, of course, about partner, whether you're having a new partner, you have whether it's casual sex, whether it was a one-time thing, whether you have just one partner, multiple partners. Then from there we can see whether you can carry drugs, or you tell your partner to come with you the next time. Yes.
Hopefully they will.
Hopefully.
There are different risk factors to different STIs. There's a way they affect you differently, one from the other. Maybe you can just break that down for us in terms of this one affects. Gabriel.
Yeah, I would say some of the risk factors, the major one is multiple sexual partners. If I'm having multiple sexual partners, chances of me getting it from another person is so high. Unprotected sex with person of unknown status, especially in the cases of HIV, people who inject drugs, they'll be sharing these needles. Again, I will say sex at a younger age. It's not directly, but again it predisposes, because given the nature of the information this person has behind some kind.
And I like that you mentioned the drugs, because other times we look at it unidirectional. It has to be sexual, but then again, the people who are sharing needles and they're doing drugs, and that could be a risk factor for them as well. When you mentioned about people walking into a clinic to just be screened, how often does that happen? Or do we come in a wheelchair? You know, like hata sasa tumeletwa na watu sasa, because how often do you see, you know, people just walking in and be like, oh, I'm just going to check, am I okay, you know?
It's actually more common than you think.
Serious?
Yes.
Oh, wow.
I actually get very many calls. I have a new partner, I need to come in, we need to screen so that, you know, we can continue with the relationship. Or someone hasn't tested in a while, then they just call us up and they want to come in for a test. But mostly it's someone had sex with someone who they're not familiar with them, casual sex, and then they'll just call us to, I need a test because I don't know where this person has been. But it's more common, common than you think. But I'm also thinking it's more common among people who know about STIs and STDs.
So from what age are people advised to do the screening? Because you mentioned about having younger people and the predisposed factors that could actually play a contribution to that. So at what age is safe for people? Is it just the reproductive age? Because the minute you say reproductive age, kids right now are getting into sex way younger than we were back in the day. So unasema age gani?
I won't say there's a specific age, like 10 to 15 or 20 to 30, no. As long as somebody has started having sex, they are at risk of getting these STIs. So I won't say like come at 12 years or 10 years. No.
Yeah.
As long as you're engaging in sex, we all know there's that risk. Come for checkup. Mind you, some of these infections will stay in your body for a very long time without you knowing. Something like HPV. It will go for even 10 to 15 years.
Whoa.
So the earlier you screen it and discover it, the better.
Wow.
So as long as you're engaging in sex, it's advisable once in a while, come and be screened.
Yeah.
Such that you get this treatment early enough.
Okay. And when we talk about the screenings and having these conversations out there, because you mentioned how if you know about the STIs, if you know there's treatment, if you know there's screening, then you're at a better place to make those random calls of, I'm changing a partner, I want to be intentional about it.
Yeah.
But if this conversation is not happening, then probably there are places that people will just continue on with their life. They're more scared of even pregnancy than STIs, and STIs are better than
Yeah.
HIV. I mean, it's just,
Yeah.
you know, the thing looks upside down. But how common is this conversation, especially uko mashinani ama in the slums? How common is this conversation, and who's driving? Is Mary Stops driving it?
Okay, I'd like to say maybe we need to do better to drive
Okay.
these conversations to marginalized areas, because you don't have many clients coming in for STI screening and treatment from these areas of special groups. So I think we'll need to do better to reach them, to tell them to come in for screening.
Yeah.
So in terms, when you say do better, what has been happening so far? Because I'm sure, I mean, you can't be, Mary Stops imekuwa hapa for a while,
Yeah.
and there's something they're doing and something that is good, because I mean, it wouldn't be here if it wasn't. So what are some of the things that probably they've been doing towards creating more information and education around this conversation?
Awareness.
Yeah, so
Thank you,
through
ma'am.
the various channels that we have one that we do outreaches. So we go to really interior places with
Okay.
our outreach services. So during these times, we give family planning for free, we give information for free, we have nurses, we have clinical officers that come on site each and every day of the week. Like even if you call us up right now, today we were at a place, and if you walk into that place, you're given the service plus the information for free. Free.
Bure.
Kabisa.
Na leo mmetoka mahali. Mahali hamtaki kutuambia ni wapi. Okay, so this happens often.
Yes.
Okay,
Yes.
okay.
Yeah. Someone, I told someone that we're going to have this discussion, and they asked me to ask this question for them. What's one of the STIs?
Yes.
Are they called genital warts? What are they called?
They're called genital warts.
Okay.
And it's one of the STIs, actually caused by the same HPV virus. You know, HPV is called human papilloma virus.
Yes.
I don't want to go so technical.
Yeah.
But HPV is a virus that is sexually transmitted in most cases. Now, there are so many types of HPV virus.
Okay.
So there are those ones that will cause genital warts. There are those ones that will lead you at some point to get cancer, the most aggressive ones.
Okay.
So genital warts, yes, is a form of STI.
So you
type of STI rather.
need to be screened as soon as possible to avoid, if it's something that can be avoided, if you're talking about HPV, or does it stay in your body forever just because you suffered it?
For HPV, if you have it,
Okay.
it normally, if there are no symptoms, it will clear from your body in 2 years.
Oh,
Yeah, so you can have it for 2 years and not know at all.
okay.
So
Do you
it
remember that case of Asha Raymond, with a woman that complained that Asha infected them with herpes?
Yes.
It's the same. So it's forever?
No, it's not forever.
Okay.
Like in 2 years, it should go away if it's not treated, if it's not progressing.
Okay.
If it progresses, that's when now you get the warts.
Oh.
Yes.
And how
when
do
you
you
get the
treat
warts-
those ones?
So warts basically look like the skin of like the color of your skin.
Okay.
It looks like part of you. Yeah, but you'll note that they're coming out many around the anal area, genital area, around the mouth.
Wow.
Yeah, around the mouth because of oral sex.
Sex.
But they hide,
Yes.
they can't hide with lipsticks?
No,
Around. Come on.
not on,
Alright.
but around the lips. So when you come, we have something like cryotherapy, which is freezing the warts till they fall off. If they are too big, then we excise them surgically. Very treatable.
Okay.
Okay, but then when you treat that, the HPV is still in my body, so that needs to be
Of course, with medication, we'll give medication as well.
So does the is it the viral load? Does it go down? Good question.
It will. Say for example that you stopped having sex with the person that was infecting you. Of course, it will go down with treatment as well.
Okay.
Yes.
All right.
Hey, that was intense, Nana.
Yeah.
That was because most of the times, see that like that particular information, some of the things that we've seen or probably had conversation around is the effects of some of this infections or diseases, right? Because I think Zimesha moved. Say for example, syphilis, gonorrhea, herpes, how do you know this one is different from the other, or do you have to really get it from a practitioner? Is it
after the screening?
Yes, after the screening, ama unaweza jua hii by the way venye inaenda hii ni kama yes.
I say typical Kenya, no? we Google first, then we get to us, then we work as in a health facility. I would say the moment you start feeling these symptoms, never ignore them. Because the layman out there is not in a capacity to really differentiate. Because you will say, let me go and buy this medication and take. No, that is wrong. You might be treating the wrong thing. So just walk in, we'll be able to differentiate it for you. Tell you that from our investigations, this is what you're suffering from, and treat you appropriately. Because you know these things, they have complications later in life. If you have them for so long, some of the complications that are bad are things like infertility, you not being able to get kids, or pelvic inflammation.
And this is for both?
Both.
Male and female?
Male and female.
Okay. Infertility?
And to some extent even death.
Okay.
So if you have those symptoms, just walk in to any of our Marisops clinics. We'll screen you easily and sort you out.
What about insanity or, mental health?
Yeah, because there's some
disorders caused by sexually transmitted diseases. Is that a thing?
Not directly.
Okay.
Not directly, yeah. But if you're having mental issues and you're also dealing with an STI, it could predispose you to have a mental issue.
Yeah.
Yes.
We're talking about all these STIs and there's, I see like a common denominator. It's like, what's the difference between now STIs and UTIs? Because zinakaa ni kama they are married kidogo, wana divorce, wana marry. What's the difference?
That's a great question. That's a great question. UTI is not sexually transmitted. Yes. And as women, we are predisposed to more UTIs because our urethra is very short. So we'll get more UTIs than men. So once you get an UTI, it's probably from candida, yeast infection,
candidiasis,
sitting on the toilet, on a dirty toilet, not wiping properly, proper hygiene basically. Low immunity can also predispose you, and also pregnant women get a lot of UTIs because of low immunity. So UTI is not transmitted sexually, but if your partner is not hygienic, he's gonna give it to you. He's gonna give it to you, and then when you get treated as a woman, you have to treat him as well. Yes. So he doesn't give it to you when you get treated. Because it's probably just lacking around his carrier. It's not but it's not going inside because his urethra is very long. So you won't feel anything. Kidogo kidogo ndio unapiganga, wewe unazunguka unazunguka bure. And especially in the village. Ndio unakuanga mgonjwa kila saa, and it's not an STI.
Great. Nimewasave. You're welcome, guys.
Asante sana. Asante sana kwa sababu kwa huo muda we have a small informative video for you to just show you what Maristops is about. When you walk in, what are the processes that you go through? What does it look like? What does it look like when ukiingia? I hear you. I hear you. I mean, Mikali, just hold up a bit. But then it's very important for people to understand, because this information that we are having here every other Friday of the month is to educate us to know that there are places that are safe, because there's stigma also around saying or going to be treated for these things. Actually, komenda hospitali kufanya hata usemi utasemaje. There's a lot of stigma there. And sometimes it's imekupata nyumbani because you are a wife, you're home, it's your man probably who's doing this, or probably the other way around. But there's a lot of stigma around that, and I don't know if that's something that you talk to the patients who come in, telling them that probably how to handle yourself now when you go out.
Yes, we talk to people. Your health is yours. You don't have to tell anyone else.
Okay.
Yes, your health is yours. So once you come into the clinic, we have people who are trained to offer youth-friendly services. So no one is going to judge you.
Okay.
No one is going to judge you.
Yeah.
Yes.
Wow, amazing.
And Lynette is ready.
Lynette is very ready for the video.
Our video is now ready. Play the thing, Lynette.
Worry about cervical cancer. Did you know that most women get an HPV infection shortly after they start having sex? This infection is the cause of almost all cases of cervical cancer. Human papilloma virus, or HPV, usually goes away on its own without causing any symptoms, but sometimes it doesn't, and this can start to alter the cells that cover your cervix and cause cervical cancer. That is why it's important to get screened regularly. How does screening work? There are various screening methods. A pap smear requires taking a sample of the cells from your cervix. This can be a little uncomfortable, but it doesn't hurt, and it only takes a few minutes. There is also a method called the visual inspection with acetic acid, VIA, where a special acetic acid is applied to your cervix to see if there are any lesions that may be early signs of cervical cancer. It's always better to catch it in the early stages, so remember to get screened regularly. Visit our clinic nearest to you to book your screening. Should I worry about cervical cancer? Did you know that most women get an HPV infection shortly after they start having sex? This infection is the cause of almost all cases of cervical cancer. Human papilloma virus, or HPV, usually goes away on its own without causing any symptoms, but sometimes it doesn't, and this can start to alter the cells that cover your cervix and cause cervical cancer. That is why it's important to get screened regularly. How does screening work? There are various screening methods. A pap smear requires taking a sample of the cells from your cervix. This can be a little uncomfortable, but it doesn't hurt, and it only takes a few minutes. There is also a method called the visual inspection with acetic acid, VIA, where a special acetic acid is applied to your cervix to see if there are any lesions that may be early signs of cervical cancer. It's always better to catch it in the early stages, so remember to get screened regularly. Visit our clinic nearest to you to book your screening. Should I worry about cervical cancer? Did you know that most women get an HPV infection shortly after they start having sex? This infection is the cause of almost all cases of cervical cancer. Human papilloma virus, or HPV, usually goes away on its own without causing any symptoms, but sometimes it doesn't, and this can start to alter the cells that cover your cervix and cause cervical cancer. That is why it's important to get screened regularly. How does screening work? There are various screening methods. A pap smear requires taking a sample of the cells from your cervix. This can be a little uncomfortable, but it doesn't hurt, and it only takes a few minutes. There is also a method called the visual inspection with acetic acid, VIA, where a special acetic acid is applied to your cervix to see if there are any lesions that may be early signs of cervical cancer. It's always better to catch it in the early stages, so remember to get screened regularly. Visit our clinic nearest to you to book your screening.
And welcome back. I hope you learned. It's not scary. They'll make you feel comfortable. You just need to walk in because your health matters, and let them do what it is that they do best. I'm just checking on YouTube. I see Grace Nduta saying very informative, much love. Margaret Shanjiro saying I'm loving this, I'm learning, thanks Marie Stops and Switch TV. In Violata Nafula says great education on STI. Grace Nachero saying I'm learning a lot, thank you Marie Stops, and we are here to give you more information and to just switch things up a bit. Baby girl has joined us. Joyo!
Baby girl is me.
Hi guys.
Hi.
I know we've covered about STIs, so I would
Yes.
like us to dive into cancer screening and specifically cervical cancer screening. What is that? Maybe explain to our audience what that is before we ask more questions. Eve?
I like how who goes fast.
Ladies first.
Gender sensitive. Okay, cool.
All right. So cervical cancer is the malignant or abnormal lesions that are present in the cervix, which is the connection between the vagina and the uterus. Yes.
And what are malignant? Give us layman terms. You know, the people who are watching, we didn't do medicine, okay? What are malignant growths, like in layman language?
That is abnormal growth.
On the
Abnormal
cervix.
growth that is cancerous.
Okay.
Okay.
Yes. Yeah.
What would be some of the things that I would feel or notice as a woman with a cervix?
Obviously.
Yeah, you know, what are some of the things that I would notice for me to, you know, get a prompt that probably something is wrong, something is off? What are some of the telltale signs?
All right. So as a woman, what you will feel is pain during sex
Okay.
and bleeding after sex, pain on urination, lower abdominal pain, and maybe back pain. And maybe you'll have periods, spotting in between your periods. That's when you know something is off.
Okay,
Yes.
but that also sounds like some symptoms of a UTI. So when do you know it's serious? Like
So,
it's you know, you need to go and get checked, because some people might actually think it's just a UTI and go get like some medicine over the counter. You know, there's people who like to self-medicate. Is it self-medicate?
Yes.
Those people who just go to the chemist. So how do you know it's serious and you need to go and get checked?
When this happens each and every time. Yes,
okay.
it's continuously happening. It's not stopping even when you self-medicate. Yes.
Okay.
Gabriel, you have something to add on to that?
Yes.
Again, I will say that she said actually it is one of the symptoms of somebody who could be having cancer of the cervix, bleeding in between the periods. It's always common practice that when a woman presents with this thing, we tend to treat it on the surface.
Yeah.
Like, oh, maybe you're using contraceptives, that's why you're having this bleeding in
Exactly.
between. And it has led many women into taking a long time, and they get diagnosed when it's so late. So when you're having the symptoms that she had said, I'll also add foul smelling discharge, or even that bleeding when you're having when you're using any method of contraception. Please just walk into a health facility, walk into any of the Marisops clinics. You'll be screened. It takes a very short time, and it's so friendly, and you'll be able to detect it.
Okay.
Yeah.
Okay. And what are some of the risk factors around that? And you mentioned one earlier.
Yes.
Maybe on top of that, and you can repeat it as well.
All right. So HPV virus, which is the #1 causation of cervical cancer. Another risk factor will be family history. If maybe your mom, your grandmom had cervical cancer, you're at risk of getting the cancer as well.
Okay.
And also, if you if you have you are a person living with HIV and AIDS, you have low immunity, and you can get infected with HPV, now leading to cancer again.
Okay.
Yes.
And is there a certain age that you're more at risk? Because you know we see cancers like a disease for the older generation. So is there a certain age group that's more at risk for cervical cancer, or you can get it at any age?
Gabriel?
Not really, but it's quite common in women between the age of 30 to 49.
Okay.
But cervical cancer, anybody can get it as long as you're having those risk factors, smoking being also one of them. So it's good you come to get tested.
Okay.
It's
So
interesting when you say that, because
Yeah.
I remember when I was, you know, like I think I was in school and I was
Yeah.
learning about these things, and when they would say the age between 30, I just felt like
that's so far away.
those people.
I know,
Now
right?
he's saying 30, and I'm like, I'm 34.
Like I'm in that age bracket. And there's something you've mentioned about smoking. So are there certain lifestyle choices that can put you at a higher risk of cervical cancer?
Yes.
Yes.
For example, multiple partners. We know HPV is transmitted through sex, and is men are carriers of HPV. So if you're having multiple partners, you don't know who has the HPV, who is a carrier of the HPV, and you might get it from one of them.
Yes.
Yes. Another thing is you asked about smoking. So smoking predisposes you to cancer because it makes the cervix more susceptible to the HPV virus.
Okay,
Yeah.
that's actually very interesting. I didn't know that.
Yeah.
Okay.
Yes.
Ed?
On smoking,
Yeah.
it won't predispose you only to cancer of the cervix.
Just any cancer.
Any other cancer.
That's
will trigger
true.
it.
Okay.
Yeah,
Okay.
so
Okay,
That's
that
very
makes
interesting,
sense.
yeah.
I went for an endoscopy the other day, and they did a little biopsy. And when they got the results, the first thing he said, "You don't have cancer." I was like, "Okay." So what should I do? Because you know the acidity and stuff.
Yeah.
So smoking. I was like,
Yeah.
"I don't even smoke."
Yeah, like I don't smoke.
So now I understand why that was the first thing that he said to me,
Right,
because
okay.
I didn't know. I wow. Okay, that's interesting.
Yeah, that's actually
Let's
very
talk about
interesting.
screening. Most people will think that probably it's uncomfortable. It's, you know, I have to. Please, Trelizini,
Yeah.
what is the rationale of that?
Why did you say but I know what you mean? She knows what we mean.
Very nice. Please.
Okay, so the rationale is for early detection. Yes, when you come in for the screening, we'll be able to know whether you have HPV, whether you have any cells that look abnormal, and then we treat it early before it proceeds now to say you have stage 2 cancer, stage 3 cancer. When we are able to detect it early, now we treat it early. Yeah.
Okay, that makes sense.
How is the screening done?
Okay.
Yeah,
Yes.
is it like, do you go through a machine, you know? Does someone check, you know, down there? Like, what is this, you know?
We talked about STIs are just like blood work.
Yeah, exactly.
So,
Yeah, what
in
is
the same spirit.
yes. What is
Yes.
the procedure?
the most common screening method is called VIA, or visual inspection using acetic acid.
Okay,
Using what?
interesting.
Acetic acid.
Uh-huh.
It's a very smooth procedure. It takes a short time, and everybody should come for it.
Short time ni
10-15 minutes.
Okay, so you get your
Everything
results
is
immediately?
ready. Yeah, you get.
Okay, okay.
It's something that we actually observe and see,
Okay.
but it's not definitive diagnosis.
Okay.
What happens is the healthcare provider will be able to put in a certain position where you lie on your back, use what you call a speculum to visualize your cervix, because that's exactly where we want to look at.
Okay.
Then he'll apply acetic acid kidogo on it, give it a few minutes, then interpret. What he's able to tell there is whether it's suspicious of cervical cancer or not. But it's not the definite diagnosis. The moment we see that aka kanaka hii cell kanaka kako hivi, then now the rest of the process takes place.
Okay,
Yes.
so it's just to see if
what
there
is
are
the
any.
sorry, Joe.
It's just to see if there you'll see any abnormal cells.
Definitely.
Okay, okay.
And then what follows after that? Say, for example, you found something that you're not so sure, or you need to take to have another, you know, examination to just be sure what this is.
All right. So when we do the examination and we've seen maybe there are some cells that don't look very normal, then you start treatment immediately.
Treatment.
Yes, you start treatment, and it's like what I said. There's a cryotherapy also for cervical cells that are not normal. We'll freeze, and then sometimes we'll exercise or remove those cells that don't look normal. Yes.
Okay.
Okay. And does that, once you start the treatment, does that mean you can't have any children after? Or like, does it affect your reproductive system when after you go through the treatment?
No, we're just removing a few cells, not the whole cervix.
Okay, okay,
Yes.
okay. Like, what if I can't have children?
Like Harry, what I don't know.
Yeah.
Me, I'm here. I want to get
Exactly.
children, but then it's okay to put out that information that
Exactly.
this is not interfering with that part of
Yes.
you
Okay.
completely.
Just a few cells.
Okay.
The cervix remains intact. All you have to do is every 3, 6 or 1 year, you come back for another checkup in case they have multiplied.
In case they've grown.
Yes.
Okay,
Okay.
that makes a lot of sense.
During the short break, we were talking about pap smear. Maybe we can just dive into that. Kwa sababu bado tuko kwa ile mwezi.
Yeah, because I need to know what it is first, because
You've never.
no.
Girl.
Guys, this is why you're here.
Exit stage left.
This is why you're here, okay?
Okay, Joe.
Yes.
It's okay.
So
It's
maybe
okay. Please.
explain, Gabriel,
Yes.
explain to us what a pap smear
Pap
smear
smear
is. Yes.
is the most known name out there.
Yes.
Pap smear. But
Exactly.
pap smear is a short form for a very long term. Papa Nicolau.
Papa
what?
Nicolau. That sounds like
Sounds like you're calling someone from the Congo, you know? Sounds like someone's name from Congo.
So what pap pap smear entails, if there are those suspicious cells that we are detected using the VIA inspection, then there's a brush a very soft brush that will be used to pick a few cells. Then these cells will be observed under a microscope. Then we'll be able to tell, are they like what?
Malignant,
Okay.
abnormal. Yes.
So the VIA is what happens before you go to a pap smear, or is recommended all over the place at this point?
Yeah.
You can do either, but if you're starting, you can do the VIA first. You can do the VIA first. If your cervix is normal, no need to go ahead with the pap smear.
Okay.
Yes. But if there's something that you've seen, then we can go and we can treat, and then we'll go ahead and do the pap smear to also see whether they are abnormal cells. If they're abnormal cells, then we go ahead and do a biopsy.
Okay.
Yes.
Okay.
Okay.
Yes.
So at what age should you start going for a pap smear? Because I feel like I'm late. But at what age is it advised for you to start going for a pap smear? Because I don't know if in your early 20s.
I don't know why you're feeling guilty. It's okay. The question
Yeah,
is
exactly. Yeah, I don't know if you're like 19 if you need to go for like a pap smear. But yeah.
Yeah.
The women who are at risk the most are between ages of 30 to 49.
Yes.
So at least between that age,
Okay.
make sure
Then you
you've
start
done.
to do it.
If you can go earlier than that,
Okay.
nobody will stop you, but it's it's as well good if you can go later, but make sure that at least within that age you've gone for that.
How
Okay.
frequently can I do that? I mean, 30 to 49, can I just do it once and be like, okay, I did it yesterday,
And wait until 49 is your party.
like how frequently should I have this tests done?
For a pap smear, it's 3 years. Every 3 years, you need to come for a checkup. If you did the first pap smear, you were treated. You need to do now annually.
Okay.
Yes.
Okay.
If we saw something and we treated you, then now you do yearly. Then we have HPV, which is the causative agent for the cancer. We do a HPV screening. If you came for the HPV screening, now the virus. If you have the virus in your body, then you have to come yearly. But if
Okay.
you don't have it, every 5 years.
Okay.
Yes.
Okay.
Gabrielle, you had something to add on to that?
Yeah, she said literally everything. for women living with HIV virus,
Okay.
it's advisable again you screen at least annually.
Okay.
Yeah.
So again, I feel like these are more questions for me, but there are also other people who've never been to a
Joya,
pap smear.
this is it.
What exactly are you checking in the pap smear? Do you like check blood? Do you check cells? What are you checking exactly in the pap smear?
As Gabrielle said, we take a brush, we swab the cervix. The brush will pick some cells. Then we observe it on a microscope, and then we'll see whether there are abnormal cells
Okay.
in your sample.
Oh, so then there's no blood required? You know,
No.
there
We
are
don't take
people
blood.
who are
Yeah, that's what's
scared of
keeping you
needles.
away.
No, I'm not scared of
Sit
needles.
down,
I'm
it's
just
And if you're afraid, you
Yeah.
can just ask, because we have different sizes of speculums.
Okay.
Yeah, you can ask for the size that you feel it's
comfortable
gonna,
with.
yeah, comfortable.
Okay.
Oh, you
with.
can?
Yes, you can.
You didn't know that, did you? That's why you should have gone to Maristow.
I really should have.
Yeah.
I had no clue that you can actually be like,
Yeah.
But then sometimes you don't even see.
You don't see
Because
it.
of the
You have no idea what's going on.
because of the position you're in, you're not. It's not like they come there tell you this. We have different sizes.
Yeah.
Which one do you? Is that no? That's never happened to me. It's just like, okay, are you ready?
Now I know to ask. Thank
Okay,
you. Now I know.
fantastic. I didn't know that. So when we say go for pap smear every other time, if you have a chance to go for the VIA, then you do that as well. I hope
Yeah.
like it's been jammed into our
Yeah,
heads as
into-
women, because it sneaks up. Cervical cancer just sneaks up on you if you've not been. You're okay today, then. And
You're
we've
not.
got so
You're
many
running
people.
True.
Let's talk about the marginalized, or probably people who are coming from areas that don't have
Lower
this kind of
income.
information. People who are disabled, and probably they look at these things as probably nizaki na nani.
It's a luxury.
Yeah. So how then do we communicate this information and provide these services to them as marriage stops?
Okay. So for the outreach that I said, that we visit different areas, we give these services for free. For free, you guys.
So what we do, weekend.
So what we do,
Joyce.
Yes.
we give this information on our social handles when we're having like free checkups. and then we say where we are going to be, then you can just pop up there. It's gonna be free.
Okay.
Yes.
Okay. So is there any
any
happening
group?
this coming weekend, in the next few days? Maybe people can look out for
Yeah.
those who are interested.
They can check on our pages.
It will be posted there.
Yes.
Okay. So,
Okay. And when we talk about the cervical cancer, there are so many things that are, put together when people are thinking about it, and how it's a death sentence, how by the way maisha
that's
yako
it.
tunaanza kukuombea, tunaanza kugawa mali and all of that. Maybe in terms of treatment, how does that go about? We've seen people talk about how they've lost hope. We've had stories of victors who've gone through, and I'm not a survivor, me, I'm a victor of this cancer. What is the treatment like for a person who's been diagnosed with cervical cancer?
Yeah, actually, just like most cancers, trust me, if you're diagnosed with one, chances are high to drain you financially, emotionally, and everything else. And most cancers treatments are depending on the stage that it's discovered on.
Okay.
Stage 1 and below, it could be
There's
managed
below
easily.
stage 1?
No, stage 1.
Oh, okay.
Kurudi nyuma. But it's stage 1, stage 2, 3, 4. Now they are A, B, depending. It's a bit technical anyway. But at stage 1, if it's discovered early, it's still treatable. And stage 2 and above, sometime a bit hard. But the better thing is just come early, get screened early enough.
Yeah, that's why we are saying you need to get screened, so that now you avoid going through the emotional turmoil, the financial turmoil that you're going to get if it progresses now to stage 2, stage 3, stage 4. And now your question about will I give birth after?
Exactly.
Now this is where the question comes. Because
okay.
you see, if it's stage 1, it's mainly confined to the cervix, and now we have to remove the cervix, and maybe for caution we have to remove the uterus as well, so that it doesn't spread there.
Okay.
Now that your question
So it
comes in,
depends on how far
the cancer
has
Yes.
gone.
Yes.
Okay, so see, that's why it's important to get tested early, because
Early,
that is
that's so
very
true.
life-changing. And what would you say is the difference in coming to get tested at Maristops? Because I mean, I've been to a few gynecology clinics, and when you're going to do like a life-changing treatment, it's not like people have like the best service. Maybe that's why a lot of people shy away from going to get checked, because the person who's supposed to be doing these things for you is not exactly giving you the best customer service. So what would you say is different about Maristops? Yeah.
Okay, so I would say it's trained health professionals. Also, I say they trained to care for the youth. So once you get to our clinics, they'll be able to handle you. They'll be able to do counseling. We also have psychologists there. So they're able to take you through the counseling, so that you get your test results. We call you up. We follow up with you.
Okay.
Yeah.
Also,
That's
it's not
good.
an
So it's not just a one-time
follow-up as
thing.
well.
Okay.
We do follow up.
It's even
We
the
do-
experience that
Okay.
you get there.
Yeah, I
Okay.
think that's very helpful, because
we
you
work
know,
with our clients
yeah.
throughout, make sure that they have the best.
so it's not just after you've been checked and you've been given any results, like they keep up and check on you. That's amazing. I should have come to Maristops, by the way.
You're
Now I
welcome.
know. Now I know.
Okay.
Yeah.
And please send in your questions, because we are live on YouTube, we are live on Facebook, and we are taking all of your questions, we're taking all of your feedback. Let us know if you're learning from these conversations. So whatever questions you have, we have the experts in the building who are going to be answering all of your questions. And there's one question. When I first saw it, or when I first heard it, it didn't make sense until today. The way STIs and cancer are so separated, but today you've shown us how that by itself can cause cancer. Na tuko hapa tukiishi venye tunataka,
You know?
instead of guarding your life with everything. See the way I just put in
True.
lifeguard wear.
I was about to say that.
Because it goes back to that.
Yeah,
It goes
okay.
down to that. If you're gonna go sexually in this conversation, then it goes down to that.
Yeah.
To that moment of intimacy, to how you protect yourself and your partner and your family, because these things go ahead and affect
Everyone
everything
in your life,
around you.
yeah.
If it's going through a cancer treatment, then that means pengine it's expensive, like you said.
Yeah.
And that means family, friends, everybody's pulled in.
Even emotionally.
Emotionally,
it's
it's very
still draining
draining.
for everyone around you, because it's not
Yeah.
you're going through it with them.
Yeah.
So it makes sense to go and get treated as early
As possible.
as possible.
And even as we say that it doesn't mean that all cancers zinakosiwa na hii. Remember, pia, if you're smoking, did you say lifestyle as well?
yeah, I was
Yes.
asking the lifestyle
The
choices
eat.
that you make, if it affects, your risk for getting these cancers.
Okay.
Yeah.
And there's something interesting that is happening at Mary Stops. There's an offer on. Please, Lynette, can we have that? as they talk to us. Please tell us about what is happening. There's a cancer awareness. Kiria, my eyes. Maybe you can tell us a bit more about that.
Yes.
Oh,
what was
Eve took away the glasses before we started. Gabriel, please.
Yes.
Okay.
Cancer awareness ends
So
October.
that is okay. Lynette, I can do this, right? Thank you. Fantastic. So there's an offer, something, great rates, discounts happening. So you need to take advantage of those subsidized rates. Get your screening for cancer, and this is happening next to St. Teresa. Ili karibu na mlango kubwa. I think hapo Juja Road.
At NHR Isli Nursing Home.
Isli Nursing Home.
Yes.
Isli Nursing Home. And this is First Avenue next to St. Teresa, Isli Nursing Home, Maristrop. So just be sure to go there. If you're looking for breasts, ultrasound, unilateral hair, what is that? Maybe you can tell us.
Unilateral means one breast.
One
Bilateral
breast.
is both of them.
Oh!
Yeah.
So you charge per Kiria? Oh, because one does not mean that both are infected.
Maybe you found a lump in one.
Okay,
Yeah, you can come for a checkup for that one. Yes.
Okay. And that the prices are there. So the original prices for one is 3,500. If you go, by the way, ukienda ni 2,500 saizi, 6,000 for both breasts. Promo price umekatiwa a whole 2,000 bob. There's the prostate ultrasound. Please tell us a bit more about that. What yo Gabriel?
Prostate ultrasound. It's the ultrasound, but it's done on your prostate.
Okay.
To rule out other comorbidities that could be there.
Is it primarily for men?
Yes.
Yes, sugar.
Thank you. I just had to confirm. No, I just had to confirm because there's some people who would ask some questions, because I know there are a lot of men who shy away from getting tested in their prostate because
just like cervical cancer. Most of us will shy away from walking into a facility to have their prostate looked at.
Exactly.
How is it done?
Yeah, there's a lot of stigma around men actually going for these tests, and maybe you can, Gabriel, you can talk to them and tell them what are the risks of not going to get tested.
If you don't come to get tested, especially for prostate cancer, yes, it will take time to progress, but in a later age, it will definitely take you down by either it will spread to other organs within your body, or you'll have the whole prostate removed.
Oh my God. I'm curious on how the test is done, because I think that's the one thing they really shy away from.
Where is the prostate?
Because for the men, because it probably isn't comfortable. I saw a TikTok video. Now that we're
talking about it.
From a TikTok video, it was very awkward even for the men who are watching another man go through the test.
Yeah.
It's invasive. That's what I'll say. It's
Yes.
invasive
Okay.
because the process, it's the way we can feel it or be able to visualize it is through the anal opening.
Yeah.
So it's invasive.
Yeah, so probably that's why a lot of men shy away from it, but there's no two ways about it. There's no other way
for us to be able to do cervical cancer screening without it being invasive.
Yeah.
The same way there's
for them as well.
So even this offer is for men as well. We're not just talking to the women.
Yes. And we have a pap smear one. Kawaida price is 3,000. Na ukienda saizi kuna promo 500 bob off, so it's 2,500. There's something else. I hope I will say it right, because
try
via vili help us
help via vilai
via vila. What is kwa karibu?
Okay. Pia mimi ningesema viva, but
ati viva. Okay.
What's that testing?
That's what he was talking about.
Oh, that was a VIA.
Okay. At least we know, even though it's the longer version.
Okay.
And of course, October being the month of breast cancer, have we touched on breast cancer in this conversation? Not yet. Yeah. So let's talk a bit about breast cancer. I'm very interested in how you said that you can be tested on one side and not the other. But what if you just want to check that you don't have any breast cancer, you have to do the
bilateral.
Bilateral.
Yeah, unilateral is one, bilateral is both of them. So when you're coming in for the screening, it's advised that you come for screening every 1 year or 6 months. If you're at risk, if you have family history, it's best to do it yearly. So we'll do first the physical one, where we'll feel for lumps around the breasts. Other than that, we can do the ultrasound. If there's something that we see is suspicious, then we can send you for a mammogram.
Yeah. The mammogram is now where they check the general cells in your.
Yes.
Okay.
But we're going. What's happening as well? This with the offer is that there's a physical breast exam. That's free.
That's free.
Okay.
Free
of charge.
Free of charge.
Okay.
Yeah.
And
will you be teaching people as well how they can?
You do it at home, because it's very doable. Self-examination.
Self-examination.
And just to make it clear, this is also for the men, right? Breast cancer as
Interesting.
Yeah.
Is there like a percentage of like men getting it at this percent and women at a higher percent, or is it the same for both male and female, the breast cancer?
For breast cancer, women are at a high risk of getting it, given that the breast tissues are much as compared to men. But if there's a man with breast cancer versus a woman with breast cancer, the progression and even the outcome, like the severe outcomes, are worse in men. Given that we have lesser tissues, so it's so easy to spread to other organs.
It will spread faster.
Unlike women. That's the sad bit of it.
Oh, that's really sad.
Yeah. So even for
I
men,
feel grateful.
I just feel educated. I was like, that is something I would never even have guessed. Like if you asked me, if it was like a quiz, can men get breast cancer? I'd have probably said no.
We equally have breasts.
Yeah, that's true. Yeah, that's true. Okay, that's very interesting.
I am still waiting. We have a few questions. Are you on Facebook? We have a few questions on Facebook. Maybe Stacey, if you can send us to us, especially me, Joyo. I think you can get it
on Facebook. Yes. Let me see if we have any feedback here.
Ooh.
I'm sorry, guys. I think my phone was not silent. Guys.
There you go again.
Oh my God.
What's happening, Joy?
Guys, I don't use Facebook. Jesus. This is why I don't use Facebook. Have you opened them yet?
So my phone can't. Can we get screenshots? Stacey, somebody, anybody, you're sending? Fantastic.
Yeah, you see, I really don't know how to use Facebook, guys.
Someone is asking, where does HPV come from?
HPV is a virus. Yes. So it can catch you from anywhere, from having sex. We saw that you can have it from. You can get it from having sex.
Okay.
Yeah.
Is it the same as, now that you've brought that up, is it the same as chlamydia, or is that completely different?
It's an STI on its own.
Oh, it's completely, yes. Okay, it's completely different.
They're different, yes.
Okay. All right, waiting on the feedback.
Okay, question. Hey, I hope I got it right. Why girls take long to realize they have an STI than
men?
Than 2 to 3 days for men or something. So women realize faster than men. Is that the question? Okay.
It's true, yes. Given the nature of how our genitalia is made, you find for men it's all out there. If there's a discharge, you'll easily see it. And like women,
it's hidden.
It goes in. Yeah.
Okay, that makes sense. All right, I'm really scared to open these comments again. See, I knew it.
Okay, let's continue. Okay, there's a question here. Is it true that if you get an STI, that you automatically have HIV? Is that it? Is that the question? Okay, that's a question from Facebook as well.
No, when you have an STI, it doesn't mean you have HIV, but you have an untreated STI, it increases your chances of acquiring HIV because your immunity is low.
Okay,
got it.
So this might sound like a very layman question, but STI and STD, what's the difference? Infection, disease, is it like HIV and AIDS?
Exactly what Nana asked.
Yeah.
Exactly.
Yeah, because I'm
please.
very curious.
Yes.
Yes.
So STI is an infection, and then STD is a disease, sexually transmitted disease. So an STI is the infection before it becomes a disease,
Okay.
before it's a chronic disease.
Okay,
Yes.
okay.
Okay. Do you have any more?
Do we have any more questions?
Fantastic. Fantastic. Okay, fine. I think that is all we had for today. We've answered all the questions. Akina kama hatujajibu swali yako, ujue mahali unaweza pata. Social media platforms. Do you know the social media platforms? Mary Stops. Anywhere people can send the questions to?
Yeah, so first they can call us on our toll-free line 0800 72 00005 for
Just say that
free.
again, slowly, because
Zero
this is
seven.
for free.
Yes.
And we need it. Okay.
So the number is 0800 72 00005.
I hope you guys wrote that
I
down.
hope they wrote down.
Because again, it is free. Free. I think that needs to be in capital letters. If you're afraid of asking any questions because you know you might be charged, do not worry. It is free. All right, I think that's it for
Yes, I think
today.
there's just a random question.
Okay.
What is the best approach on someone who has STIs? So I'm assuming this person is asking about someone you know they have STIs. Ama you suspect they have STIs. What's the best way to approach them with your fears?
So I think if it's someone, it will depend on the nature of your relationship, of course.
Yes.
If it's a sexual partner, then you can just tell them out of the blue, we need to go and get checked. You know, you've never gotten checked.
Yeah.
You know your love language. You have to use your love language there.
So now to get them to go get checked.
Yeah, let's go get checked. You know, get check on ourselves. If it's your friend, then you can give them information as a way of a push. Like, you know, I know this place, Mary Stops, they have these tests that, will you take me? Yeah,
okay.
also encourage them to go and take the tests.
Okay,
as
and also
well.
I don't know why this question has come to me now, but if, it's because it was a conversation a while back, I don't remember who won the debate, but if someone has an STI, right, and you share a bathroom, like you all use the same bathroom, can they transfer the infection to someone else who uses the same bathroom?
For the bathroom, I wouldn't say that you're going to get the infection. It will depend on how long they use the bathroom. It will depend on the type of STI. But yeah, there are STIs that can be transmitted skin to skin. Yeah.
Okay. Thank you so much.
Yes. I don't know where that last question like, oh my God, those parties you have in your house.
Exactly, and people are not going to get tested. They're just spreading it.
Okay.
It's serious. But thank you so much for joining us today.
Yeah.
All the social media handles, I'm sure they were mentioned, and thank you so much for joining us today on this live. I hope you guys learned as much as we did. Please, even us, we came here knowing almost nothing. I hope you guys learned as much as we did, and thank you so much, Eve and Gabrielle, and thank you, Mary Stoves.
Thank you for having us.
Okay.
Bye.
Adios.